Hello, I'm Dr. Petersen. And before you come in for your consultation for liposuction or liposuction with fat transfer to the buttocks, what we call a BBL, I wanted to go over some of the things to expect about surgery and recovery so that you can think about what questions you want to ask when you come in to see us. I just think things go better when you know what to expect before you get here. When I do liposuction, I start by injecting fluid and medications into the fatty tissues. Those medications have numbing properties and also help restrict bleeding. They begin to break down the tissues, and then I can more easily suction out the fat and fluid. But because we start by injecting fluid, some of that fluid stays in the surrounding tissues, and you'll experience a lot of leakage and drainage from your surgical incisions over the first few days. It's really helpful to understand this ahead of time so you can prepare and so that you don't worry that you're bleeding in a dangerous way. We like to joke that liposuction is a water sport, and you'll be wet after surgery for the first few days. As you can imagine, that fluid also contributes to swelling after surgery, and some people also experience bruising. That is normal, and it can take a full 6 months for all of your swelling to go away. Usually after surgery, it gets worse before it gets better, so we don't want you to get discouraged as you wait for your final result. And there will be some pain after surgery as well. This is usually short-term, although there are rare instances of long-term or chronic pain after liposuction. That long-term or chronic pain could come from a nerve injury during surgery, and nerve pain is a little different. It's experienced as a sharp, almost electrical zinging pain that travels along the nerve pathway. If you experience this kind of pain, there are special medications we can use to try and help quiet those nerves. You may know that every body lacks perfect symmetry. Our faces aren't perfectly symmetric, and when we talk about breasts, we like to say sisters, not twins. And the same can be true of other areas of our bodies that we want a liposuction. Thighs are not perfectly symmetric, or flanks or love handles are not perfectly symmetric. So although we do everything we can to get the best symmetry possible, there may be asymmetries that persist after surgery. All surgery has associated scars. The nice thing is that liposuction scars are very small, about the size of a pencil eraser. Everyone's body scars differently, and some people are prone to making poor scars. But for most patients, the scar will fade to a thin white line, although it can take a full year for that to happen. We want to make sure you protect that scar from sun or any UV damage during that first year, as that UV exposure will make the scar permanently darker. Along with scarring, risk of infection always accompanies surgery. Fortunately, the risk of infection with liposuction is very low, but it is still possible. We give you antibiotics to help prevent this, and that is the only medication we give you that we want you to take until it is all gone. You may have drains placed during the procedure if you elect to have Renuvion skin tightening done with your liposuction, and we will explain more about that during your consultation. If you have to have drains, we want you to be taking antibiotics as long as you have the drains in place. So what is Renuvion? It is a skin tightening device that delivers energy under the skin in the form of a helium plasma beam. That energy tightens the connective tissue of the skin, helping to combat the risk of sagging skin that can result from liposuction. Picture letting some air out of a balloon that has been blown up for a while. The balloon surface may look wrinkled and droopy. That can happen with surrounding skin when we remove some of the fat volume. Renuvion helps to tighten that skin. We love the results we see from Renuvion, and we can discuss it if it seems like something you might need or want. But when we use Renuvion in the abdomen, there can sometimes be a collection of fluid under the skin that is a natural part of the healing process. That fluid is referred to as a seroma, and the drains help remove that fluid from the body, which speeds healing. That is why the use of Renuvion may require drains where liposuction alone may not. Bleeding after surgery or a buildup of blood under the skin and tissues would be referred to as a hematoma, and that's a rare thing with liposuction. However, it is important to follow your postoperative instructions to avoid this and other complications. That includes no exercise, heavy housework, or heavy lifting for 6 weeks after surgery. That means not lifting anything over 5 to 10 pounds. You will also wear a compression garment for 6 weeks after surgery, and that helps encourage swelling to resolve faster. One thing that people worry about most after liposuction is a lumpy appearance of the scar tissue or wrinkling skin contour. This can show up as depressions and indentations under the skin. It's crucial that you do your postoperative massage to the liposuction areas. I ask my patients to do massage 4 to 5 times a day for the first 3 months. This helps the body smooth out the collagen layers the body uses to build scar tissue as part of the natural healing process. We have a massage therapist that comes to our office, and he offers special post-operative packages to outpatients. But even with professional help, you'll be needing to do your own daily massage. Getting a foam roller that athletes use for their muscles can help you. And it is important to note that unfortunately, liposuction will not treat cellulite. It's possible that it can even worsen its appearance when the skin is looser over the areas of liposuction. Liposuction is not a weight loss surgery, and you will likely see little change on the scale even as you see results in your body shape and contour. Liposuction won't prevent you from gaining weight in the future. However, the way you carry that weight may change because we have changed the way your fat cells are distributed in your body by permanently removing some of them. It is a myth that liposuction causes weight gain, but people may notice the weight gain in different ways because the weight is carried differently. The bottom line is to stay healthy and take care of your body to maintain your surgical results. You've made a significant investment and gone through a lot of work recovering from surgery. To be safe, there's a limit to the amount of liposuction we can do in one surgery. Therefore, for some patients, we may not be able to do all the areas of liposuction they would like to do at once. Know that if this is the case for you, we are making decisions based on your safety first to prevent vascular, fluid, and electrolyte imbalances that can be dangerous. Another one of the risks that we monitored the most is the risk of blood clots, or DVT, during and after surgery. There are several precautions that I take, but the most important thing is that I want all of my patients up and walking after surgery. I do not want you to go home and lay in bed for a few days. You will need a responsible adult with you after surgery for at least 24 hours, and one of their jobs is to make sure you get up and walk every 1 to 2 hours, even overnight the first night. We want you to walk. I hope this educational information is helpful as you are considering your surgical procedure. During your consultation, we will take pictures and I will do a physical exam so that we can tailor our discussion specifically to your body and your goals. So come with your questions and let us guide you through this exciting transformation journey.